let's sanitize our hands first. Mayan Gobi ma'am.
Mayan Gobi doc.
I am Vishal Bhutekar, third year medical student of the Medical School Foundation. I am here for the examination of your baby of the pulmonary area.
Okay.
So for this examination I need to ask few questions. So I will start with asking the general information about the baby. So is it okay if I start?
Okay doc.
Okay. Can you tell me unsay mong pangalan?
John.
John. Pilay mong edad?
1 month old.
1 month. Unsay mong religion?
Christian.
Christian. Unsay imong trabaho? Okay. What is your occupation?
I'm a housewife.
Housewife. Okay. So in this examination I will be going to do the 3 steps. That will be the inspection, palpation and auscultation of the chest area. So for this, baby is lying in a supine position first of all, and now I will check the skin. That is, there is no swelling or any rashes are noted over the skin of the baby, and there is no signs of distress or anything is noted, or any congenital abnormalities like is noted here, or any kind of hernia like umbilical or anything is noted. Skin is well pigmented and it's absolutely normal. So next will be the palpation, and there is one more step, like there will be the no percussion in the babies because our baby is 1 month old only, that's why. So we will just do the palpation and auscultation, and before palpating I will just do the auscultation of the baby. First I will auscultate the airway, then right and left bronchi, the sounds of the lungs of the baby. For this I will be going to use the diaphragm, the stethoscope. So I will start. Usually the sounds will be harsher and louder in the babies as compared to the adults. And now I'll be going to check the right and left bronchus of the baby to check any kind of distress or any obstruction or any abnormalities in the sound like retraction, grunting or any kind of distress that will give the diagnosis. Then I will check for the left bronchus. Okay, now I will check for the left bronchus first, right bronchus. Okay, both the sounds are symmetrical on both the sides of the like right and left bronchus. Now I will check the lung sounds, usually to check any sign of like grunting or anything abnormal sounds or pneumonia. Okay, there are no abnormal sounds are noted in the auscultation. So the next will be I'll be going to check the respiratory rate. First of all I will tell, like in the babies there will be the breathing pattern will be the abdominal pattern. So I will just check the respirations of the baby. I will just keep my hand over just above the belly and check how many times baby will breathe. So I will count for some time. Okay, it's almost 38, and the normal range of the breathing pattern is 30 to 60, and in our baby it's almost 38. So the next will be I will be going to palpate the chest of the baby. For this I will be going to keep both the hands over the sides of the chest of the baby, and when the baby is crying I will check for the symmetry of the vibrations of the sounds, for the vibrations. Okay, I can able to feel the vibrations from both the sides of the lungs, so there are no abnormalities in the palpation also. And That's all, I guess. Like, I did the inspection, palpation, and auscultation of the baby, and as in this examination, I will add one more thing. I will check the heart rate of the baby. Okay, it's almost 130. The normal range will be the 90 to 180. The heart rate will be more in the babies also, so it's normal. So as we are done with this examination, do you have any questions related to this examination?
No, doc.
Okay, I will just summarize the details. As our patient is John and your housewife and his 1 month old baby who came for the examination of the chest area, that is pulmonary. So I did the inspection, palpation and auscultation. So there are no abnormal findings in the inspection of the baby, like swelling or redness or anything or any congenital abnormalities. Then there are no abnormal sounds of the babies that will suggest any kind of disorders. And in the auscultation also, breathing patterns are breathing sounds are normal. They are harsh and little bit louder than the adults. So do you want to add anything in this examination?
No, doc.
Okay. So as we are done with this examination, thank you.
Thank you, doc.